Arizona expands its vaccination efforts to Pima County.
It's part of our mission to serve the community, and I can't think of a better way for us to do that.
Turbulent times for Arizona's airports, the pandemic's impact on travel,
We lost millions and millions of dollars.
and new opportunities for uninsured Arizonans to gain coverage.
You might be surprised that the federal government will help you buy insurance.
Hello and welcome to Arizona 360. I'm Lorraine Rivera. Thanks so much for joining us. More than 1 million doses of the COVID-19 vaccine have gone into the arms of Arizonans, a milestone that came the same week the state unveiled the location of its first mass distribution site in southern Arizona. The University of Arizona will serve as the third high-capacity vaccination site run by the state.
It's part of our mission to serve the community, and I can't think of a better way for us to do that than providing this service to our citizens.
Similar to the site at State Farm Stadium, university leaders are hopeful it will eventually operate 24/7. For weeks, the U of A has served as a destination for the vaccine. But by partnering with the state, organizers think they will have the capacity to go from administering 800 doses a day to 6,000.
All we are trying to do is all work together to get as many people in Pima County vaccinated as fast as we can.
That will come down to supply, which continues to trail demand.
The state is the one that makes the decision about where the doses go. We don't make that decision, and the counties don't make the decision.
Over the phone, Governor Ducey told The Buzz the state is putting pressure on the federal government to increase its share.
Arizona is getting what it should from Washington at this point, but what Arizona needs is more. So I've asked our county health officers here to hustle it up. I've asked Dr. Christ to hustle it up, and I've asked Washington, D.C. to hustle it up as well. What we really need from Washington today is more supply.
As with other sites, an appointment is required. People can begin registering at 9 a.m. this Tuesday, either online or over the phone. Of the vaccines available in the U.S., Pfizer's is approved for people ages 16 and up. For Moderna, it's age 18 and up. Clinical trials are underway to test the vaccine on children as young as 12. We discuss the process and some common questions about childhood vaccines with Dr. Wasim Balan, a pediatric infectious disease specialist at Phoenix Children's.
What we know so far from the side effects of the vaccine or the adverse effects that are seen in adults doesn't seem like it's anything that should make us worried about kids, but obviously we still need that data to prove that it's still safe and effective.
Are you hearing from parents who would like to get their child vaccinated?
We're hearing obviously a lot of interest from parents about the vaccine. As you know, there's a lot of excitement about the vaccine, and we're pretty excited about this. Obviously, the supply is still kind of limited, and it's being rolled, by phases at this point. But we've definitely heard a lot of interest from parents, especially parents of children with medical conditions that would put them at high risk of severe disease if they catch the infection itself.
There are people who are skeptical of vaccines. When you have a parent who's concerned, what sort of conversations do you have with them about talking about a vaccine?
My typical approach to those situations, because obviously as an infectious diseases physician, I definitely come across some parents who have a lot of either vaccine hesitancy, or sometimes they're just completely against the vaccine. And the first step is trying to figure out what is the cause of this hesitancy or skepticism, as you mentioned. And a lot of times it just takes giving the right information and maybe guiding the parents to to where to find that right information, instead of just going on the internet and then getting this information from any source. As you know, I mean, anybody can put anything on the internet these days or on social media, and it's very easy to come across information that is not true. And our job as physicians in general, pediatricians specifically, and more specifically infectious diseases physicians, is to try to provide the right information and go after what is the cause of that skepticism, and try to see if we can provide the right information that would make them think twice about that and see the benefit. I mean, obviously, a lot of the vaccines that we use in childhood were developed for a reason, because those are, potentially lethal potentially lethal infections. And this is what was the drive for developing the vaccines against those specific infections.
Early on, the virus was not thought to affect children to the levels that it has for adults. That being said, the vaccine, as we know, is being prepped for children. You recommend it once it is ready and available?
I absolutely do. Once it's proven that it's safe and effective, obviously, as I said, those are the main, things that we want to look at. But hopefully, once the studies are out and they prove that it's the same outcomes that we've seen in adults, where it's safe and effective, I would absolutely recommend that for a couple reasons. Even though the infection itself is less likely to cause a severe infection in children, we are still seeing some children who, are needing hospitalization from the infection itself. The other thing is that, there are some, post-infectious complications that we're seeing in some of the kids. One of them, we've been talking about for the last few months now, is called MISC. And that's an immune reaction to the infection itself that's putting kids in the hospital. The other, important part of, why we would need the vaccine in children too, is because when we're looking at this from a public health, view, we want to make sure that as many people as possible, including children, are vaccinated to stop the spread of the virus in the communities. And obviously, children are part of that community, and even if they might not be themselves getting sick from the virus, they can get infected. They can take it back home and infect someone who might be a high risk person for that, and also contribute to the spread in the community.
Dr. Baleen, do you recommend the vaccine for women who are pregnant or breastfeeding?
So, at this point, we don't have specific data about that. There's theoretically, it should not be a problem for a pregnant woman or a breastfeeding mom to take the vaccine. And, all the scientific, bodies that, basically take care of pregnant women or breastfeeding moms have come out and said that it should be up to the mom to decide. We're not saying it's not safe, don't take it. We simply don't have the data to prove that yet, but that's being looked at through the CDC. Now, obviously, we have more than 42 million doses of the vaccine that have been given in the US, of both vaccines, the Moderna and the Pfizer vaccine. And the CDC is collecting safety data on all patients or all people who are getting the vaccine, and some of those are pregnant women. I think the last numbers that we've seen from the CDC is that there are more than 15,000 pregnant women who've taken the vaccine. So there's enough data that's going to be collected about this to hopefully prove to us that it is safe. The one thing that I would say to keep in mind, where I would probably say that take the vaccine, is we know that getting acute COVID-19 during pregnancy is a high risk situation on both the mom's health and the baby's health. The acute COVID-19 has been associated now with preterm birth. So we have premature babies who are born before their time, and that obviously carries with it, some health risks for the baby, but also it has some implications on mom's health. So when you're looking at, getting the infection during pregnancy versus getting the vaccine, we should definitely lean towards, getting the vaccine, knowing that so far we haven't had any concerns about, giving the vaccine to pregnant women.
Dr. Wasim Balan from Phoenix Children's. Thank you.
Thank you very much.
Among the industries set back by the pandemic, air travel has taken a significant hit. Arizona's two major airports report a plunge in the number of passengers who passed through last year. But as Tony Paniagua reports, the future offers some hope.
The coronavirus pandemic has brought a drastic economic downturn for airlines and airports around the world. They are reporting the steepest decline in passenger traffic in decades.
Our numbers did drop quite a bit.
Bruce Getz is the Vice President of Operations at Tucson International Airport. He says TIA had fewer than 2 million travelers last year, the lowest number since 1982.
And essentially, we ended up 2020 with only about 40% of what we were the previous year in 2019. So a pretty precipitous drop.
and the impacts are like a domino effect. Fewer passengers translates into job losses for airlines and rental car companies, along with a decrease in airport leases from stores and restaurants, among others.
You know, we lost millions and millions of dollars. We were grateful for the CARES Act money that came through. The airport did receive a little over $20 million in CARES Act money to help us with our operation. And we're using those things to offset the revenues that come with a 60% drop in passengers.
At Sky Harbor International Airport in Phoenix, year-end passenger numbers also plummeted by more than half. In 2020, the airport got nearly 22 million passengers compared to a record of more than 46 million in 2019. But despite the drop in passenger traffic, Sky Harbor officials say the airport had an increase of nearly 10% in cargo freight numbers. Also, airlines at Sky Harbor have added or are scheduled to add new destinations soon, including Cabo San Lucas, Cancun, and Puerto Vallarta, all popular vacation spots in Mexico. Back at TIA, airlines are also adding destinations. Southwest Airlines will take you nonstop to Oakland, California, and Houston, Texas, for example.
We are rebounding slowly, and as we get into late February and March, we are seeing airlines come back and add some additional destinations. Allegiant is one of them that's coming back soon, and they're going to Provo, Utah, and Las Vegas. And, we're constantly talking to our airline partners about their current schedule offerings.
Airports are trying to help by working on health and safety measures. At TIA, administrators have spent about $300,000 on various programs, including new signs, UV sterilization systems on escalators, toe kick buttons for elevators, and hand sanitizing stations. It is also providing free COVID-19 testing to the community, although airports in Arizona currently don't require a negative test result for departures or arrivals. However, travelers should check with their destination or airline ahead of time.
Some destinations throughout the country, Hawaii is notable for this, that you have to have a PCR nasal swab test, a negative test within 72 hours of your arrival.
For passengers like Sally Graham, flying is faster and more convenient than driving. She's going back to her home in Indiana from a work trip in Tucson.
I wasn't hesitant at all. I thought it would be less or more hectic, but it was actually less hectic. There's not very many people flying comparatively.
What was the airplane like when you got on?
Every other row was empty, and there was only 1 to 2 people in each section.
TIA's plans for the future past the pandemic include a $300 million project in the works to improve its runways. Like airlines and airports around the world, it hopes the travel industry will soar again soon.
Long term, no major tenant or anybody has left the airport yet, and we don't expect them to. So I think everybody looks to rebound from this. How long it will take is anybody's guess. We're hoping with the vaccine rollout, we're seeing a lot of positive trends. But I think in general, we're all hoping for a decent turnaround in 2021.
Arizona's economic recovery has been uneven, with some sectors better off than others. Economists at the University of Arizona say as of December, the state replaced nearly 70% of the hundreds of thousands of jobs lost between February and April. It outpaces the national average by double digits. While trade and transportation saw strong gains, leisure and hospitality remain in a rut. We discussed these trends with Glenn Hammer, the outgoing president of the Arizona Chamber of Commerce and Industry.
We've recovered well over 2/3 of the jobs lost at the peak of the pandemic. We're still down tens of thousands, and those are mostly in hospitality and restaurants. Other sectors of the economy, construction and manufacturing, are doing well until things like IT are doing well.
You've often been a voice in the ear of the governor. I imagine there were times that you provided useful advice, but there were times that perhaps warranted some reason to disagree. Looking back over this last year, are there things you wish you would have done differently here in the state?
Well, the importance of people on their own doing the right thing can't be overstated. I know that there's this notion that let's just have a governor or a president say something or wave a magic wand and everything will be okay. That's not the reality. I mean, if you take a look at California and Los Angeles, for example, where they've had great surges, unfortunately, and they've had hospitals overwhelmed. Well, let's face it, California is not run by Newt Gingrich and Republicans. It has a very different political philosophy. And the reason why I'm saying that, at the end of the day, people are going to make decisions. At this point, we all know you should wear a mask, you should socially distance, you should stay home when you're sick, you should avoid large crowds. But I believe the way the governor has handled this has been really has had the right touch. Most cities in the state, including in Tucson and southern Arizona, have mask mandates. Most people realize the importance of social distancing. We've reduced crowds, but this idea that just go into a year-long plus lockdown is not the right answer. And I'll also say that I believe the governor did a very good job with the state superintendent of public instruction in setting parameters so that we could have in-person learning as well, which we've learned really is not a vector for the spread of the virus.
Some industries like trade, transportation, utilities have managed to grow during this time. How did that happen?
Well, we are seeing a shift in the economy to online purchases. And when you think about what's going on, and I just take a look at the convenience in our own house, and I try to tell my wife and daughters, convenience doesn't mean free. uh, you just see this massive change in our economy to people doing things that are more convenient. So what's happened is on the logistics side, e-commerce side, jobs have just been exploding, and that has created a dynamic where it has helped offset the massive job losses that we've seen in the tourism industry and the restaurant industry.
A number of Arizonans remain out of work. According to data from the Department of Economic Security, the week of February 6th, more than 250,000 people received some form of unemployment.
What I would say to those individuals that have lost jobs through no fault of their own is thankfully Congress, in a bipartisan fashion, has provided extended unemployment insurance with the $300 plus federal top up. That's very likely to be extended. So our view is for those small businesses that have been hit very hard, and for those employees who've lost jobs because of the pandemic, it's important that they have that federal support until the vaccines really kick in and their jobs can return. And I would expect that with the Democratic Congress and with the administration, that it's very likely for those workers in hospitality and restaurants, as well as for small businesses that have been hard hit, is that there's going to be additional relief until we get to the other side of this.
Are we putting too much hope into the vaccines to get out of the damage the pandemic has caused?
Too little. The vaccines, that's the ticket out. And when you take a look at what's happened in Israel, that has vaccinated many more times people than we have, like everyone in my age in Israel has not just received one dose, they've received two doses. I've received zero. We should be putting, the president has a goal of 100 million in 100 days. That should be 300 million. We should be throwing the kitchen sink. The efficacy of these vaccines are so high. It is the closest thing to a silver bullet.
And you're saying Arizona already has that formula of business in place for when people are ready, they can get right back out to spending.
A- ab- Absolutely. I mean, the infrastructure is there. I mean, our world class resorts. What I've been predicting now, it's the weather's a little bit cooler in Tucson than in Phoenix, but I really believe that by the time we get to this summer and many more people are vaccinated, you're going to have people from all over the country coming to Arizona, staying in our resorts all over the state. I believe by the end of this summer, we will have returned every last lost job. Now, different industries, perhaps, but we will be at a higher employment number than we were pre-pandemic. We're likely to reach that point by the end of the summer.
Okay. Glenn Hammer from the Arizona Chamber of Commerce. Thank you.
Thank you.
Some who lost work because of the pandemic also lost their health insurance or are struggling to keep their coverage. In response, President Biden signed an executive order that created a special enrollment period on healthcare.gov. We discussed options for Arizonans with Jim Hammond, publisher of the Hertel Report, which covers the state's healthcare industry. Give us a sense. How has the pandemic impacted healthcare in the state of Arizona?
Well, the first answer is severely, significantly. As an industry, the healthcare industry took took a hard hit. When you think about the number of hospitalizations and the number of deaths, it's been a severe blow. But the industry figures out how to bounce back and adjust, and I think that for the most part we have. We did not have to go to crisis standards of care recently in the hospitals during this most recent surge in January, which was a good sign that we kind of weathered the storm with the hospital resources that we had.
I understand that the system was able to adapt, and you couldn't have prepared for this crisis. But were there any areas that said, "Hey, we should have been doing that all along," or "We were somewhat prepared"?
Sure. Well, telemedicine is the big one. Uh, in Arizona, we were pretty far down the road of saying, hey, telemedicine is a good thing. Let's encourage it. Our access program had already set forth new rules that said we want to cover telemedicine in all these different situations. And then the community came around and the health plans said the same thing and said, what we do, we want to encourage telemedicine. So that's one thing where we were kind of prepared and we did well. Some groups weren't prepared for that and they had to struggle to create their telemedicine platform for their patients so that they can connect better. But overall, I think the industry was prepared for that.
With regard to telemedicine, how did that affect the elderly or people living in poverty? Were they able to come up to those standards when needed?
Well, I think in some cases there was help. There are pockets of places where people got help. But for the most part, I think that down in the poverty level is where we struggle. And that's a theme that goes right along the whole spectrum of healthcare when we talk about the ACA and open enrollment now and what's happening with this crisis and the disparities that we see. To me, it's about poverty. And when you have a significant number of your patients or your community that live in poverty, you're going to find that people are going to not be served. They're not going to have the resources to engage in telemedicine.
You mentioned the Affordable Care Act. The enrollment has been extended. How do you see that rolling out here in the state of Arizona over the next few months?
Well, it depends on how much traction we get with the media and with healthcare.gov promoting the fact that this is available. I think it really depends also on people's willingness to go in and see if they maybe qualify for some help. I think there's a lot of disinformation and misinformation about the ACA. So if people need to know that if they make less than 400% of the federal poverty level, which is for a family of four about $100,000 a year, for one person about $50,000 a year. If you make less than that, then you should go to healthcare.gov and check it out and see where you come in. And you might be surprised that the federal government will help you buy insurance. There's no plan that you have to take. The federal government helps people buy insurance, and you buy it from the regular market, from Blue Cross and United and Cigna and a few others, Centene, Bright Health, and a new one called Oscar. They're all out there willing to sell insurance with a federal subsidy to folks that are uninsured and make less than those numbers we quoted earlier.
And given that the pandemic continues, the uncertainty remains for people who are watching this and worry that they may not be covered in the event of the worst case scenario. You're saying the government is providing an option for them.
Absolutely. And this is what we call a special enrollment period. So they've even relaxed the paperwork that people have to go through to say, hey, look, why do I need insurance right now? You just have to declare that you are unemployed or you're earning as such, and go through the process, and you may qualify for assistance. And we think the Kaiser Foundation thinks that over 250,000 people are eligible for access, which costs them really nothing out of pocket. And those are folks that make less than 133% of federal poverty, which is around $27,000 a year.
For the skeptics who continue to question the ACA and how it's been manifesting throughout the healthcare system over the last few years, what do you say to them?
Well, I would say that there are 153,000 people in Arizona that think it's important, and they used the healthcare.gov to buy themselves insurance and get some help from the federal government. And they're now no longer uninsured. So we helped those 154,000 people. And then there's the Medicaid expansion, which is probably closer to 500,000 people now that have benefited from the Medicaid expansion we went through in Arizona. So all in all, we've helped 750,000 people get coverage where they wouldn't have had coverage before. And we know that people, when they're not covered, they do two things. They delay care, which is all just a waiting game until it blows up, or they just or they go to the emergency room and they don't pay the bill. And both of those things are not good outcomes.
I know at the Hertel report, you study the trends that are happening nationwide as the pandemic continues. There are many unknowns. What's being left out of the conversation when it comes to healthcare?
Well, when it comes to healthcare, I would say it's probably the this uninsured problem. We have a huge part of our society that don't engage in the healthcare system. And then we have a crisis and we wonder why there are these disparities of care. And you can blame a lot of different things for why people don't buy insurance, right? It's too expensive, they just don't believe in it, whatever the reason is. But when a crisis happens like this and we have people that do get sick, we all pay for that. And I think that that's kind of missing from the conversation right now, is that if we were better prepared and had more people that had coverage, that when they had that first cough, they went to the doctor or they got telemedicine. And if it was worthy of a visit, they got a visit. And people aren't doing that when they're uninsured. They're not engaging in the healthcare system. So they stay out and out and out, and then it bubbles over, and we all end up paying that bill eventually.
All right, Jim Hammond from the Hertel report. Thank you.
Thank you very much.
That's all for now. Thanks for joining us. To get in touch, visit us on social media or send an email to Arizona360 at azpm.org and let us know what you think. We'll see you next week.